Most people assume that more light equals better results. Is that true? Is there such thing as overexposure?
So you start slow, maybe 20, 30 minutes twice a day, and then maybe you increase it to an hour within 3 or 4 weeks. But you can also overdose, which means it's not going to help you.
Welcome back to the Primal Reset podcast. Today, we're joined by Rachel Huveldt, the founder and CEO of BIOLight Therapy, a company pioneering in clinically backed red light therapy devices, both for the home and professional use. Rachel's become a trusted voice in the biohacking and wellness space, helping bridge that gap between science and accessibility in light-based healing. Rachel, it is a pleasure to have you. Welcome to the show.
Thank you for inviting me. I really appreciate that.
Share with me a quick 30, 60-second overview of how long you've been in the industry and what got you to start BIOLight Therapy.
I've been in the healthcare industry for over 60 years. I've done acute care nursing. I've worked in hospitals in management. I also have been fortunate enough to help a physician open his own clinic and really been in the industry a long time. I sustained a near miss 3 cervical herniated discs where I experienced a great deal of pain. I did not know about light therapy until my dog became paralyzed. And after one treatment, he started walking again. And I realized that here was a technology that could have helped me when I had my near miss and could help individuals that suffer from chronic conditions.
So, light-based therapy, walk me a little bit through that definition. We've seen it on social media all the time. A lot of us have used it for those overnight masks and healing those wrinkles or boosting our collagen. What does red light therapy really do?
Well, it does all of that. It actually does all of that. However, there are different types of apparatuses out there for light therapy. The correct term is photobiomodulation. Photo meaning light, bio meaning biological, modulation change. So it works at the cellular level, but not all of the appliances that are out there do the same thing. It all depends on the frequencies that are programmed into the product. So we can definitely go in further in depth into what really is out there, but the public can be very confused. Red light therapy really has a lot of different frequencies that one can use to target different aspects of the body.
And walk me through the frequency discussion. People don't know too much about that. I'd love to learn a little bit more.
Well, there are different different lights, and what we have is really frequencies that are part of the sun. If you sit out in the sun in the morning and the evening, you're going to get the blue light, and that helps with the mood. It helps really for rejuvenation. So you have different lights. For the face, for example, you might have yellow light, which works on wrinkles. You might have blue light. Blue light works on staphylococcus and is one of the only frequencies that helps with diabetic wounds. You have red light, which goes about half an inch, is more superficial. You have infrared, which can go 4 inches and basically can be programmed to treat different tissues of the body.
Okay. And what's the difference between the red lights and the rest? We've seen infrared and red light kind of be the pinnacle of all these new saunas that are coming out and in all the med spas and all the spas. What's the difference between infrared and red light?
Well, I think it's more what you're trying to treat. Your infrared will actually go into the organs and the muscles in the body. What we find is there are different appliances out there. So I did a study, and I learned that the medical device that I have and medical devices that may be out there will actually treat chronic disorders. But that is because the pad is right on the body, and you're absorbing the entire energy of the light. If you have a panel based on the study that's on the wall and you're 6 or 12 inches away from it, which is what the company tells you to do, the light dissipates and you're not getting the full effect of the light. So that panel isn't going to help you as much as when putting the pad right on the body. So it's important to know that most products out there on the net will have red and infrared, but you're not going to get the results of putting it with a machine that actually is programmed to treat different levels of the body. You're going to get light therapy and it's going to make you feel good, and you may be able to reduce some of your pain. But when you're looking at chronic disorders, unless you're using a medical device, you're not going to get the effects that you want.
And when you mention medical device, we've seen so many out there, and even the cheaper products on Amazon, all the way to going into a med spa or going into using BioLight Therapy's devices as well. What's the difference between an at-home use and a professional use for a red light therapy or an infrared therapy device?
Well, your at home works. It definitely works. What I do in my practice is I treat chronic disorders, and an individual may come in on a scale of 1 to 10 with a 9, which means that they're in serious trouble. The light therapy heals because it works at the cellular level. So we have trillions of cells, and in each cell there's a little component called the mitochondria, and that is how the light is absorbed in the mitochondria. And there's a photochemical reaction. The blood increases in circulation because the veins are dilated, and you get oxygen to the area that needs to heal. And you then get lower inflammation, which is disease, and pain reduction. So what I do is I take the individuals through that healing process. And once they're healed, then I recommend the at-home product, because they're no longer in that chronic condition. And now they continue the healing and maintain what we have been able to accomplish in my clinic.
Okay, so red light therapy we've used or we've seen being used as a trend more on a surface level, trying to get those fine wrinkles out, trying to get some skin conditions to reverse or make our skin look a little brighter or feel better when we're sitting in a sauna with red light or infrared. Red light therapy was truly built to help chronic disease more than the skin condition or the wrinkles on our skin. Is that right?
I think it's the other way around. I think
Interesting.
initially it was, you wouldn't find this type of product at the public. When I first started doing this in 2014, there was very little information on the net on light therapy. It has exploded. It has exploded. Most of the products that are out there are going to help you feel good, skin rejuvenation, but it's the other products that really drill down and get the chronic conditions that really is what's happening now. But of course, you're going to have, the industry want to sell you light therapy. And again, you may get some pain relief, but trying to get the chronic conditions, that's a bit of more of a challenge.
Yeah, I mean, it's funny that you mentioned that going into this was for rejuvenation to begin with and kind of that surface level healing, and it's formed into something so much bigger, and we've seen it, like you mentioned, explode. And a question on that, looking in the future forecast of it, within the next 5 years, 10 years, we've seen more and more of these masks, these overnight masks or nighttime masks kind of being more popular. Do you think that'll be more of a staple in the society within the next 5, 10 years?
I believe so. I think what's happening right now is that photobiomodulation is being used for cognitive decline. And that is an area that I'm very, very interested in. About a year or so ago, because I'm an old nurse, I started having some cognitive issues where I couldn't recall words. I was having problems with numbers. I was having problems scheduling patients. I started using my helmet, and that is all gone. That is no longer
Wow.
an issue. I am an affiliate with a company called Neuronic, and they are leading the industry in cognitive health, mental health. And so that
Wow.
is now the new future, where there is a lot of information out there about using light therapy for mental health. And Neuronic is amazing. They have and they've only been around for about 4 years. And I am going to be using my helmet in my practice, treating individuals with or for their body, and at the same time treating them with the light therapy. Yesterday, I treated a woman who has long COVID. She came in, she's very depressed, she's not a happy camper, and I went ahead and did a treatment for her for mental health. She called me yesterday. She said, "My whole life has changed. I feel so much better. I'm back to my old self." So photobiomodulation for the brain is huge. And that is now the leading edge of what's happening.
Wow. I mean, that's so interesting to hear it expanding in so many different ways. And let's break down on your opinion of what really red light therapy is. We talked about frequencies earlier. Expand on that for me.
There are different frequencies, and for example, blue might be 400. You can take it up all the way to about 1,000. And so the frequencies determine the depth at which the machine has been programmed. So most of it is red and infrared. You're going to see with the masks that you're going to have the yellow, the blue, the purple, and what have you. But it really is the red and the infrared that is going to give you the best results. And the red may be around 600, 800 might be for your infrared, and so on.
And when we say frequencies, what we've heard this word being used a lot, and there's different frequencies in our clothing as well as in our mitochondria and our cellular level inside of our bodies, as well as everything exterior as well. What is the biggest thing on frequencies that helps heal our bodies internally?
It all depends on how your product is programmed. So we know that certain frequencies will work on the tissue at a certain level. So it's really the depth of the frequency and what you're trying. For example, if you're using the frequency for acne, blue light works on acne. It's more superficial than the frequency that is red. Red will go more deeper into the tissue. So it's really the depth of the light that goes into the tissue. And we know that certain frequencies will treat certain levels. And so the deeper the frequency with your red and infrared, the deeper it goes into your tissue. But there are ranges for all of those.
And deeper meaning the higher the frequency or the lower the
The
frequency?
higher frequency is going to go deeper.
Okay.
800
And
nanometers, for example, would be a frequency then that would be your infrared.
okay. Do you think frequencies is the answer to healing our bodies internally?
That's right. The medical device that I have was programmed by a molecular biologist. And therefore, what he did was he has minutely programmed my machine so that I can treat anything based on his protocols. And he determined the frequencies that he programmed into, for example, the lungs, the kidneys. The I have a woman that has, and I don't know whether this has helped her, but she has an aortic aneurysm. And she came to me with another issue that I treated. And I also treated her heart. And over the years, her aneurysm has grown. It has now reduced in size. And she believes that it's the light therapy.
Wow. The power of belief and the power of frequency. When we talk about multiple devices, and there's so many different companies out there as well, what makes your device different than everyone else's?
The fact that it was programmed by a molecular biologist. That is what
You're,
makes it different. And that is what the study that I conducted indicated, that ours is superior because we treat organs, because we're able to treat chronic conditions. And the other ones will help you, definitely, but they don't have the level of what I would say ability to really treat chronic conditions. The other thing is that when you come in with an acute problem, for example, you sprained your ankle, if you let that ankle continue to be a problem over the 6 months, a year, what have you, it throws your whole body out. So if you come to me, it's going to take me longer for you to heal with that ankle because you took too long a time to come to me. Your hips may be off, your spine may be off, and you're now in chronic pain. If you come right away, I can treat you. Within a week or two, you're fine. And so people allow chronic conditions to continue, and that's when they get into trouble. That's when they get
is
in trouble, and it takes longer to heal them because of that. I had a gentleman that came in with mold toxicity. I treat mold toxicity, which you get from buildings that are damp, and the mold is inhaled, and now you've got that mold in you, and it affects your lungs, it affects your whole body, your intestinal system. I did about 12 sessions on him, but I did, and he healed. He then, I told him, I said, it's going to come back and you need the at-home pads. So he said, oh, I'll be fine. Sure enough, a few weeks later, he called me and took the at-home pads. What I did not know is that he had been on what they call binders. So you go to the doctor, they test to see what mold you have. They then prescribe binders, which the mold is attracted to. You consume the binder, and now you excrete it through your system. He had been on it for 2 years. He stopped taking the binders when I did the treatment. Afterwards, when he healed, his doctor conducted some tests, and the mold was completely gone. That's unusual. Experts will tell you it takes about 5 years with binders to get rid of mold. And what happens is people have this problem. They go to a doctor, a regular doctor, they don't know what they have, and they put them on steroids. And that's the worst thing you can do. So chronic conditions take longer, but then you really need to maintain. And that's what I do with the at-home prep.
Is there a proactive approach to using red light as well?
I'm not sure what you mean by proactive.
More as a preventative.
Yes,
If you were to utilize it every single day, maintain your body with red light therapy, and
absolutely.
that that gets sprained or whatever might happen in someone's life, does it help prevent?
Yes, yes. Using light therapy is like going out in the sun, except in the middle of the day. It really is helpful. If we didn't have the sun, it's just the frequency of the sun. If we didn't have the sun, we wouldn't be here. We need the sun. And that's all it is. It's those are the frequency of the sun. They've been to harness, able to harness. And it isn't new. The Egyptians used to use colored glass to heal people by just harnessing the sun to the individual. So it's not new. It's not new.
Technology has definitely caught up and helped us utilize that, whether we go outside or we don't.
Yes,
Um,
yes,
Most people assume that more lights equals better results. Is that true? Is such thing as too much overexposure?
that's a great question. So with my medical device, what happens is that you've got the circulation going, it continues for anywhere from 36 to 72 hours. Okay, you've got that system going, healing. But the other challenge about light therapy, you progressively heal. So it might take you 3 to 4 weeks to heal. With an incision, it might take you 10 days. So it accelerates the healing process. That's what light therapy does. Okay. So you can continue to use it and you can start using it any time to keep you healthy. But there is a problem of overdosing with light therapy. So if somebody comes to me and I treat them today, they have to wait for a day or two because that process is still working. It's not helpful for me to treat them the next day. And it's progressively improves your situation. Now, the at-home pads do not have the number of LED lights that my system has. My system has over 1,200 LED lights. It's very powerful. The ones that you find on the market, might have 60, 100 LED lights. So you can use them more frequently. So you start slow, maybe 20, 30 minutes twice a day. And then maybe you increase it to an hour within 3 or 4 weeks. But you can also overdose, which means it's not going to help you. Okay. So therefore, the process stops.
Interesting. It's good to know that. We always think if something's going to help heal us, the more we do it, the more it's going to heal. And it's good to know that there is such thing as overdosing on red light therapy where it actually doesn't help at a certain point. So definitely use it in spaces when you have something
Yeah. Some
that
people, some people think more is better. Not in this case.
more is not always better. That's true. So my last kind of question, I mean, you started BioLight Therapy in 2014, way ahead of the curve before it got super popular. You're
Yes.
completely bootstrapped. And I mean, in a space that was dominated by influencers. How did you win everyone's trust without having the hype?
I guess it has to do with my nursing background. I think that gives me credibility. I think the fact that I've had a great background in healthcare. And the fact that it helped that I saw my paralyzed dog, hind legs paralyzed dog, start walking again. That was eye opening. And that was in about 2014. And I saw that and I knew here was something that I really needed to look at. The gentleman that developed the machine in 2000 has a company called PetLight.vet, and he treats about 30, 40 animals per month. It works. It worked on dogs. It works on horses. There are pads now for horses and dogs, small animals. And so when I saw this miraculous, I didn't stop. I had to purchase that machine. And then I started treating friends and family. The most dramatic at that time was a gentleman that was a friend of ours that was into kidney failure. And his wife came and said, "Can you help him?" His filtration rate was at 21. And the doctor said, "You go to 20 and you're on dialysis." We treated him over a period of a couple of months, and we brought his kidney filtration rate to 41. We kept him off dialysis. And recently, I treated a gentleman that came in for neuropathy of his feet. Looking at his medications, I could see he was a diabetic, he had cardiovascular issues and other issues. And I said to him, "What's your kidney filtration rate?" He did not know. He'd gone from 50 to 40 to 31. And I said, "We're not going to treat your neuropathy, we're going to treat your kidneys." And I took him up to 40.
Wow.
So you will hear that medication will slow the progression of kidney failure, but it will not prevent it. We are able to increase the filtration rate.
I mean, that's an incredible story, and you've helped so many people in the past, well, 11 years now, which is incredible. What are the next steps that people can take in their own wellness journey, and where can they find more information?
I think that for individuals whose health is good, I think light therapy can help them to for minor pains and aches to help them feel good. I think that they can prevent, and if they have small injuries and what have you, it can help them. I think the trend now is for brain health, and I think that that is critical because if we can keep individuals cognitively well, we can actually help individuals with Alzheimer's. It can reverse Alzheimer's. With the medical device that I have, it can reverse Alzheimer's. It helped me, and there's proof that it helps. So staying mentally healthy and with individuals that are starting to have cognitive decline is a huge, huge, huge benefit to individuals that go through the process of seeing their elderly fail. And all of the issues that come with Alzheimer's are horrific. So if you can keep an individual mentally healthy, that will help families in helping their loved ones stay healthier and more active with light therapy. That is the trend now in photobiomodulation, and the one that I have embraced.
It's amazing. If anyone is out there looking for the next steps of their wellness journey, looking to whether you're on the younger side of the generation or looking at more of a chronic disease or might have cognitive failure, go reach out to biolighththerapy.net. Go reach out to Rachel on LinkedIn, book a call with her, talk with her, see what she can do to help or if she can point you in the right direction as well. Start your wellness journey. Go look at all of the links in the description below with Rachel and BIOLight Therapy. Rachel, it was a pleasure having you on the show today. We'll definitely have to do this again.
Thank you so much, Elliot. I really appreciate your time. Thank you.